Introducing Group A13 from Psychology and Lifespan Development paper. My name is Olivia Nelson, student ID is 0965048, and I'm studying Bachelor of Health Science, non-endorsed, hoping to do either nursing or my paramedic degree.
Hi, I'm Janine Clark, student number 0964042. I'm in the first year of studying my BHSC, majoring in nursing.
Hi, I'm Toni student number 9503929, and I'm doing this paper as a certificate of proficiency. Okay, so in our verbal presentation we'll look at 3 of John Heron's communication interventions and demonstrate how they could be used in a medical and therapeutic setting. In our scenario, our patient is Courtney. She's a 13-year-old schoolgirl and she's come to the North Shore Health Care Centre to find out the results of a recent blood test that she's had. She'll be told that she has type 1 diabetes.
We will demonstrate how we as health professionals would convey information about Courtney's diagnosis and offer an understanding environment to Courtney to discuss her feelings and emotions. We will be using the informative skill, which is an authoritative approach, as well as a catalytic and cathartic communication methodology, which is part of the facilitative skills of John Heron's communication interventions.
Hi, my name is Olivia and I'm going to be presenting on the informative skill, and I'll be playing the role of a nurse whose 13-year-old female patient has just been diagnosed with diabetes type 1. Hi Courtney, my name is Olivia. I'm going to be your nurse today. I'm here to tell you that the doctor has told you that you have type 1 diabetes, and I'm here to just tell you a little bit more about that and how we're going to treat it and what to look out for. Okay. You've been feeling the symptoms you have, like the mood swings, passing more urine, thirst, abdominal pain, and that is because of the diabetes. Now the diabetes type 1 you've got is otherwise known as IDEM or insulin-dependent diabetes mellitus. Insulin is a hormone that prevents your sugar levels from going too high. This is called hyperglycemia, meaning high blood sugar. This condition can be managed very well as long as you're very vigilant with it. You're going to have to test your blood sugar a couple of times a day, and this involves just a small prick on your finger. Testing your blood sugars, you're going to know whether or not your blood sugar is going to be too high or too low. A normal blood sugar ranges between 4 millimoles a litre to 7 millimoles a litre, and anything below 4 is called hypoglycemia, which is low blood sugar, and anything above 7 is called hyperglycemia, which is high blood sugar. You may experience the following symptoms with hyperglycemia, like you have been currently experiencing with the mood swings and passing more urine, thirst, abdominal pain, nausea and vomiting. But on the other side, if you're having a hypoglycemic attack, you could experience shakiness in your hands, a slurring of your words, or blurry vision, and you'll become real sweaty and still have mood swings though. Okay? If your blood sugar is too low, you may need to eat something with high carbohydrates or with sugars in it, but you need to be careful not to go too overboard. And what you could do is eat a couple of jelly beans. That's really good. And yeah, but not to overdo it. Before a meal, you're going to have to take your insulin, which is all it is a small syringe with a little needle in the end. It's very tiny, you can't even see it. And you have to just put it in the top of your abdomen, either side here, okay? You're probably feeling scared right now, and that's okay. I'm going to give you these pamphlets to read through so that you can understand the condition a bit better, and also get someone to talk to you about how you're feeling and what you may be going through. I'll now hand you to a very good friend who will be able to talk to you about how you're feeling and what you're going through. And her name is Janine. Okay?
Hi Courtney,
Hey.
my name's Janine. Are you happy to sit down and just talk to me about some general issues that you might have with your recent diagnosis? Okay. Alright, there's a few changes that are going to happen in your life. And what do you think that those changes might be?
Well, Olivia told me that I'd have to like inject myself and keep a monitor of my blood sugar and stuff.
Mm-hmm. Okay. And do you just know anyone else who perhaps has diabetes and someone of your age group, or anyone else at school?
I used to a few years ago.
Right. And did you know what they had to do?
Not like very well, but we knew that he had to inject himself and he had to go out before lunch and do something that we didn't really know what he was doing.
Okay, so you at least have a heads up about what is actually going to happen to you. Oh, that's excellent. Now, as you've been told, you're going to need injections.
Yeah.
One of those injections you're going to need at lunchtime. So that's going to require that you may have to duck out of class, or you might have to find a place to do your injection. Do you have any idea of a place at school that's nice and private, or somewhere where you can do your injection?
Well, outside our classroom there's this thing we call the back room, which is like, it's just this little room that has like blacked out windows so nobody can really see.
So that would be an excellent place to do it, because it'll only take a very short period of time and you won't be missed for very long. Alright? Do you play any regular sports at school or outside of school?
Yeah, I play hockey and judo.
Okay, so how often do you do that a week?
Judo twice a week, and in winter I do hockey twice a week as well.
Alright, so you're a pretty active teenager.
Yeah.
So, based on having diabetes, what do you think that you might need to do to combat any hypo attacks?
I'm really not sure.
Okay, we can explain that more to you later on, but one of the things that I can tell you, it would be a good idea for you to always check your blood sugar, alright, before you do any physical activity, because that's going to have quite a physical effect on your body, alright. How do you feel about meeting other teenagers of your own age or a similar age that have diabetes? Does that appeal to you?
Yeah, I think so, because if they already had it, they could probably like tell me about it if they're inexperienced.
Okay. Well, there is a diabetes organisation that's based in Mount Eden, and they have camps for teenagers, and they just have general get-togethers and discussion, and just a place where you can telephone other people and just talk about your general feelings or any problems that you might be experiencing with your diabetes. And I'll be able to give you a pamphlet for that, for you to have a read over, and we'll take it from there. From a catalytic perspective, I've shown Courtney that gaining an element of self-reflection will prompt her to consider what she needs to do to help her deal positively with the biological effects on her physical body that diabetes will have on her. It's also important for Courtney to realise that the psychological processes that may be ongoing for some period of time while she learns to adapt and handle situations that she is definitely going to encounter, especially considering her entry into adolescence that she has embarked